Press.
All right, I have noon. And so we'll have a few more folks joining us, I'm sure. But since we have a fairly full agenda and we'll have a rich discussion today, let's go ahead and get started. Good afternoon, everyone. And welcome to this webinar event entitled School Mental Health Financing and Sustainability, Using Stimulus Funds to Advance Comprehensive School Mental Health. My name is Adam Wilk. I'm the policy lead at the Southeast Mental Health Technology Transfer Center and its School Mental Health Initiative. I will be moderating today's discussion, and I am here with a few of my colleagues at the center, Sarah Trello, Tara Kalk, and Allison Hu. If you encounter any technical issues or have any questions about the webinar, please feel free to reach out to Sarah Trello or Tara Kalk using the chat box feature. If I can anticipate one common question now, yes, we will be making today's slides and webinar recording available on our website, and we will be emailing all event registrants a direct link to these materials in a few days. You all should be enabled to turn your cameras on, and so if you are comfortable doing so, we would encourage you to turn on your cameras so that we can see you all too, rather than speaking into the void. We also will be taking your questions about the content of today's webinar using the chat box. So please do make a regular use of the chat box. Post your questions there at any time, and we will take as many as we can during the Q&A portion of our time today. All right, next slide, please. All right, let me give you just a moment here to read our disclaimer. All right, next slide, please. All right, so for those of you who may be unfamiliar with our organization, the Southeast MHTTC is located in the Rollins School of Public Health at Emory University here in Atlanta, Georgia. We serve the 8 states of HHS Region 4, that's Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee, by promoting the implementation and sustainability of evidence-based mental health services. And within our School Mental Health Initiative, we provide training and technical assistance and resources to leaders in our region to aid in the advancement of comprehensive school mental health systems. At the bottom of the slide, there are links to our website, our social media, and registration forms if you wish to receive newsletters and information about more Southeast MHTTC resources and events. So please do check those things out. Next slide, please. Important note, as a heads up at the end of our webinar today, we will be asking you to kindly take a few minutes to assist us with evaluating today's webinar as is required by our funder. We will provide you with a link to our evaluation forms. It'll be just one link, but there will be 2 evaluation forms that come up for you one after the other. These forms together give us the opportunity to hear your valuable feedback and be guided by it as we develop future resources and webinars. So keep an eye on the chat for the link, and we will be sharing the URL for the evaluation in our slide deck later on as well. All right, next slide. So before I introduce our esteemed panelists today, I wanted to provide a bit of background for today's topic, financing and sustaining school mental health using stimulus funds. In general, school mental health can be financed using many different sources of funding. Medicaid is a major source of funding, both in tandem with IDEA, the Individuals with Disabilities Education Act, and separately through fee-for-service billing to the state Medicaid agency directly or to Medicaid managed care plans. And Medicaid includes several different benefits too, including coverage for screenings and many treatments under EPSDT, and for administrative services in many cases, though not everyone knows about that yet. Our center has prepared several different resources on these different components of Medicaid, and more are coming. And about how those components of Medicaid can be used to finance school mental health. So if you're interested, please check out our product catalogs finance section if you are interested in learning more about them. I'll put that link in the chat here in just a moment. School mental health can also be financed using Department of Education resources as under Title IV Part A and Title I of the Elementary and Secondary Education Act, and through a number of other resources, including private insurance, federal grant programs like Project Aware, and others. And of course, school mental health financing often takes place using multiple sources at once. All right, let's move to the next slide, please. All right, so now, in response to the COVID-19 pandemic, Congress has passed a series of economic relief acts, which have included increasingly large allocations of dollars referred to as elementary and secondary school emergency relief funds, or ESSER funds. You'll hear us use that acronym several times today. These funds included more than $120 billion under the ARPA, or the ARP Act, signed in March of this year. The ESSER funds are funneled to local education agencies, or LEAs, through state departments of education to meet many needs related to hiring, learning loss, preparing schools for reopening, and addressing air quality concerns, among others. Many policy leaders have recognized that these funds represent an important opportunity for LEAs to advance school mental health in multiple different ways as well. All right, next slide, please. The U.S. Department of Education resource highlighted specifically that LEAs may use ESSER funds to hire mental health providers, either by employing them directly or by contracting with community providers. They may expand online mental health counseling services. They may provide supports for different types of individuals who may be experiencing trauma related to the pandemic, including students, families, teachers, and LEA staff. They may provide mental health literacy training, and they may evaluate student needs related to mental health or disabilities, or other approaches. And we are very fortunate today to have with us leaders who are taking several of these approaches to leveraging ESSER funds in these districts. All right, next slide. All right, so before we get to our panel, I wanted to conduct a couple of quick poll questions here to get a sense as to where everyone's thinking is right now related to the opportunities and obstacles in using ESSER funds to advance school mental health in your communities. So let's get the first poll question up here now, and I'll give everyone a few moments to read it over and select your top response. If you could use one-time stimulus funds to support one school mental health related need in your community, which of the following would you prioritize as the first program to implement? Great. Got about 60% of people responding. Okay, so let's end the poll now. and take a look at the responses. So we've got 7 individuals prioritizing a Tier 1 program expansion or new launch, 6 individuals expanding or launching a Tier 2 program, 5 expanding or launching some Tier 3 program or supporting Tier 3 services, and then a few other folks selecting other options. But it seems like there's some specific focus on programs at different tiers along the continuum. Okay, great. Now let's move on to poll question 2. Okay. What is the greatest obstacle you anticipate your school district would face when seeking to use stimulus funds to support a new school mental health program or reform or expand an existing program? The biggest obstacle. I see my colleague Allison nodding at the frequency with which respondents are specifically identifying limited workforce capacity as a key obstacle. I think that may be in part because our center has focused a lot of attention and time to developing resources related to workforce capacity. So again, another plug for the resources on the Southeast MH TTC website if you're interested in seeing, for example, our 32-page report on recruiting and retaining school mental health workforce. Strongly encourage folks to check that out. All right, so let's close the poll. And it looks like workforce capacity is the biggest obstacle being identified here. 11 respondents selected that. And then a few respondents selected administrative burden, pushback from key stakeholders, or limited understanding of the stimulus funds or allocation mechanisms. Well, we're going to try and help with that last one here today as a part of our discussion. And hopefully we'll have an opportunity to talk more about how workforce issues can be addressed using ESSER funds in the panel or in the Q&A. All right, so let's stop the results sharing and move ahead to our panel. Allison, if you please, move us to the next slide. There we go. Beautiful. All right. So now without further ado, let me introduce our panelists. First, we have Dr. Nancy Turner, who is the Director of Mental Health for Rock Hill Schools in South Carolina. Dr. Turner has also served as the Director of Exceptional Student Education in Spartanburg School District 2, Cabarrus County Schools, and Union County Public Schools. And Dr. Turner started her career as a special education teacher and site administrator in the Charlotte-Mecklenburg School District. She continues to work in collaboration with a variety of resources to create and implement connections and support for the Rock Hill District and community. She has had the opportunity to share these innovative mental health initiatives on Good Morning America, WCNC Charlotte Today, as well as local radio and other social media. Next, we have Melissa Morse, who is the Chief of Learning, Performance, and Strategy for Henry County Schools in Georgia. Melissa leads the academic accountability and strategic plan work for the district. She designs and implements the systems and processes that sustain improvement for student achievement and growth, systems of accountability from the boardroom to the classroom, and most recently, the community-inspired path to the future for students through the strategic plan. Prior to joining the Henry County community, Melissa was the Director of Instruction and Innovative Practice for the Cobb County School District in Marietta, Georgia. As a 26-year educator, Melissa is dedicated to transforming the public school experience for students so that they can engage deeply in their learning, find school meaningful, and create pathways for success as members of the community. Next, we have Fred Latschar, who is the Director of Student and Employee Mental Health and Wellness in Henry County. Mr. Latschar currently oversees 53 mental health and wellness facilitators throughout all Henry County schools, as well as the district's wellness plan for staff and students. He has over 17 years in public education as a teacher, assistant principal, and most recently district leadership. Also from Henry County, we have Jessica Stormer, who is the Executive Director of Student Services for Henry County Schools. Ms. Stormer's leadership portfolio includes the school's counseling, school social work, school psychological, Section 504, and mental health and wellness departments. Prior to joining the Henry County Schools team, she engaged in 10 years of direct practice and supervision of mental health and child welfare services. In her current role with Henry County Schools, she has over 14 years of experience in designing systems that lead to positive outcomes in student wellness. Thank you all very much for being here. All right, so we're going to hear from Dr. Turner first, and then I will transition us over to Mr. Latschar and Ms. Morse from Henry County. Ms. Stormer will be joining us for the Q&A portion of our discussion in just a bit. All right, let's turn to the next slide, and Dr. Turner, please take it away.
Well, welcome everyone, and thank you for that wonderful introduction. I'd like to tell you all a little bit about Rock Hill Schools and where we are and what we will be doing soon. So in a nutshell, Rock Hill is one of the larger school districts in our county, certainly not the largest in the state. We have about 18,000 students, 24 schools. We actually have quite a diverse student body, but as you can see, the primary population is Caucasian and African American. We're about 44% free lunch. And we do have some wonderful focused learning campuses from our alternative schools, a new virtual academy, adult ed, and day treatment centers, which I will tell you more about. We are about 20 minutes from Charlotte, North Carolina. So we have a lot of families that will live in Rock Hill. Of course, their children will go here and they will work in Charlotte, North Carolina. All right, next slide, please. I think it's important to talk about what has happened in prior to the ESSER funding. And what has really happened is talking, making sure that others are aware, and I'll get to that in a little bit, about what the needs are through data and other means. But in place prior, through funding from general funds and other school district funding, we have put together behavior interventionists for our 14 elementaries to work with our children in crisis. These are highly trained but non-certified staff. We have been contracting for many years, actually, with our local Catawba mental health agencies for site-based therapy, which is very beneficial. And even before the ESSER funds, we have been able, through our general fund, to hire a handful of Rock Hill employed mental health therapists that also offer site-based therapy. We were also able to put together a day treatment center, a class in elementary and a class in middle. It is a start, hiring the personnel and certainly the materials that we need, and certainly our secretarial staff needed for day treatment. So we have had wonderful understanding through our finance department, which I'll talk to you a little bit about in a short while, about what the needs are and using general fund. Next slide, please. Some of the actions to get to that point of receiving funding through the general funds are the actual reporting, the actual collection of data, bringing teams together, task force together, advisory councils together, looking at what we already have. We have OSS, ISS, expulsions, taking a look at internal committees, forming external committees, and determining what priorities are based on the current data we have. With our site-based mental health therapists, both contracted and employees, taking a look at the referrals, who the referrals are, and to what extent do our site-based mental health therapists see the children and their families. For 6 years before I became the director of mental health, I was the director of special education in Rock Hill Schools, with mental health under the umbrella, and many of you are probably having this in your school districts as well. So reporting, being on the agenda for the principals meeting, the cabinet, the school board, anyone really who will listen and have an understanding as time goes on, and doing comparative analysis to make sure that the understanding of the growth of mental health issues is real and the needs are there. Next slide, please. What we have implemented, just starting with our ESSER 3 funding, in order to really get down to our individual students and take a look at what is needed, not only with students who've been referred, but students who have not been referred. Is this universal screener? There are many on the market. There are many research-based universal screener. We have gone with the BIMUS, but bottom line is the universal screener, which does cost money. We will be using this for 3 years and gleaning all types of reports and, of course, reporting the information. Our site-based mental health therapists, we have been able to add. We are up to 7. We are hopeful in the next year as well to add 2 more. It's a wonderful balance between the contracted and our site-based. We are able to all offer therapy, but we are not billing in as the employees, and so they are able to see all children. Well, the salary for the director of mental health, that is me, and so this is for 3 years, but as the reporting continues, we will hopefully, and I'll talk more about sustainability in a little bit. Another addition is the crisis management assistant. Part of the focus early on has been elementary. And although that's a wonderful focus, and it continues to be, as the teams got together, advisory councils got together, we all came to the conclusion that our middle and our high certainly need to have a focus as well for mental health. So a crisis management assistant, much like behavior interventionist or elementary, are very highly trained, but non-certified staff, one at every school. We are continuing to contract with the use of ESSER 3 funding for an adolescent psychiatrist, so very helpful for our day treatment classes, med management, working with our staff, the families, the children. What a benefit it has been. Continuing to contract with mental health providers with Catawba, also contracting with local university staff, bringing in experts for training and outside experts for training in the community and in Charlotte, the greater Charlotte area. Next slide, please. There are a few innovative services and grants that we have been working on that I'm so excited to tell you about. These are the brainchild of the task force that we have put together. Once the ideas come out, then we'll talk to those who can help and bring them on board. I'll tell you a little bit about the Parent Academy. This is a live stream, and it is through a live stream Zoom through our Rock Hill Facebook and YouTube. We bring on presentations, experts, every Tuesday from 6 to 7. It is a free access. Really, anyone watching today can access. Just go to the homepage on the Rock Hill School District and click on the Rock Hill Facebook. I don't mean to sound like an advertisement, but we are bringing great information on mental health, on areas of resiliency. Even our local pediatricians, even the dentist came on. We have more than one dentist, of course, in Rock Hill, but came on to talk about masks are being removed. Have we been taking care of our teeth? We have expanded the Parent Academy to wellness, bringing in yoga instructors. Even many of you may be familiar with jazzercise. Also, we've just added another component, cooking, with our Chef Jenkins through our Applied Tech Center. We've had between 3,000 and 5,000 viewers and now expanding into the greater Charlotte. So that's really very exciting. The Bounce Back Now app was initially a community outreach with the Medical University of South Carolina. It is now free, by the way. Again, anyone watching today, you can download the Bounce Back Now app on your iOS phone. But we were able to help them pilot and give them feedback. It's like the Calm app, but it is free. And so it's a wonderful benefit. Conversation Cafe has been an online chat for Zoom for all and any of our Rock Hill employees. We facilitate this, staffed by our mental health therapist, myself, some of our school psychologists, and it's really to begin a conversation and let others just chat and talk about their stresses. We will have some topics, but they're very broad. We have launched a mental health hotline that was launched July 1st. It is for the community and, of course, beyond. We have had calls from all over. We do staff this with our therapist, our employed Rock Hill mental health therapist, myself, some school psychologists. We do not offer therapy. We listen and offer resources that would be in the community and beyond. We also launched a mental health email account. And it comes right to the Department of Mental Health, which I will just tell you right now is me. And that's okay because we will expand and we are able to answer a lot of questions. We have some awesome partnerships and grants. One big one is with the Institute of Education Sciences, and this is a partnership with the University of South Carolina, and we're very excited about this. We are also so excited about our Hayden Hurst Foundation grant. I'll tell you just a little bit about this. Hayden Hurst, as many of you may know, is a tight end with the Atlanta Falcons, and Hayden has suffered through the years and still does, has some mental health challenges. He has felt so strongly that he wants to help others. He formed a foundation, and through this foundation, there has been monies available for South Carolina schools. I even believe Atlanta and some Georgia schools are involved. Also, the Hootie and the Blowfish Foundation has offered money through the Hayden Hurst Foundation. The focus is on social emotional learning. Through this, we have had wonderful curriculums called In Focus with training through the foundation grant, as well as now another partnership through the Van Robotics Company in Columbia, South Carolina for Abby the Robot. And although we don't have time now, I will tell you that Abby the Robot is aligned with the curriculum. We have 145 Abby the Robots in our school, and you can just bet those children are motivated. Next slide, please. So in a nutshell, we're looking at sustainability. We do have some awesome mental health programs and services, but what about when that money is no longer here? We continue to work with finance, not only myself, but others that I work with, the executive directors of elementary and secondary, our superintendent and cabinet. They're always updated. Right now, and hopefully in the future, one of the prioritizations for our district is mental health. The cabinet, the school board sees the need, and they will continue to see the need as data is collected from all areas, including the universal screener. The partnerships, we will continue. We are currently writing new grants with Winthrop University and other universities. So these partnerships are huge, also with our community outreach activities. We will continue our surveys and data collections, looking at, has there been a decrease or an increase with all of these wonderful services, programs, innovative services for OSS, ISS, what are the changes? And then we will make new recommendations through our advisory councils and leadership. And next frame, please. And so Many of you may be interested in Abby the Robot. So there you go. There's some where the funding is received. Hayden Hurst Foundation, I can't tell you enough about them. They are awesome. And there is actually that third link will show you the actual use of the SEL in focus curriculum along with the use of Abby the Robot. All right, I thank you for this opportunity.
Thank you very much, Dr. Turner. Those are great resources. Very glad to have them here. All right, Allison, let's skip to the next slide. And as a reminder to our attendees, if you have any questions for Dr. Turner or any of our panelists, please enter them into the chat window. We are monitoring that window now. And we will get to those questions after we hear from Henry County. All right, next slide. Let me turn it over to Mr. Latschar. Fred, can you take it away for Henry County, please?
100%. Well, good afternoon, everybody. Again, I'm excited today. Fred Latschar. I'm excited to partner with Missy Morse and Jessica Stormer as we talk about how we went from community voice to the boardroom to the classroom with our procedures and processes to develop specific needs and wraparound services for our schools, employees, and staff. As you can see, Henry County is nestled a little bit outside of Atlanta. We are one of the larger school districts in the state of Georgia, and at some point, we were one of the fastest growing counties in the state and across the nation, which means we had very fast growth, very rapid change, and we had to really make sure that we had processes and skills lined out for our communities to reflect this change. One thing I wanted to highlight here real fast as you kind of look out how our county's made up is our elementary therapeutic program. That's something new for Henry County this year. What we did was we created a K-5 kind of intervention program for kids that were having tough times returning to the classroom. Children that were having a hard time through traumatic events, loss of loved ones. So now we have a school that is dedicated to provide high-level education and also wraparound services for these kids as they were transitioning back to a normal school day. And as we start kind of shifting to kind of other funds on the next slide. Title IV Part A, again, this is a great companion resource with your ESSER funds. We use this funding to kind of grab resources around SEL and mental health. When you start looking at the Title IV plan for Henry County, we actually have 2 wellness specialists from this pot of money that we use to support mental health across the district and at the school level. We also use this to help support wraparound services for students in crisis and need, tutoring service for children, McKinney-Vento students, or students that are in high need. And then at this point, I kind of, again, shifted over to Missy right now to kind of really dive into that work of the ESSER funds and really got us to the point where we are today.
Awesome. Thanks, Fred. Well, I really appreciate everybody tuning in. And what I would love to do, if you could slide to the next slide, is really show you the way that we went about approaching our ESSER funds for ARPA, which we call the third dip of ESSER ARPA, the American Rescue Plan Act. What we did was bring together a large team from across the organization representing every job family. And we said, listen, we know based on the work that we had been doing that Fred just mentioned that had been previously happening, we know that we've got 4 key areas of investment that we have to consider so that we can be smart about this influx of federal money. We also knew that with federal money comes a real high level of accountability to what are you doing with these funds and how have you engaged stakeholders in helping to determine how these should be how they should be spent, and then how are you ensuring that what you are spending your money on is actually providing you with a return on investment. So you can see here that these are the 4 investment, we call them buckets, investment buckets that the Henry County School District used when we were putting together our ESSER 3 or ARPA plan. Learning environments, everything that needed to be adjusted or modified as a result of bringing students back to school, and modifications to the actual physical building. I'll skip the second one, go to the other 2, and then come back to the student wellness. All that we needed to do to invest in the return to campus, kids who had not been on campus in a year and a quarter, what did we need to do to ensure that their return this year was going to be smooth? As well, as I heard in Rock Hill, we also had to, and we have expanded our Impact Virtual is our virtual school, used to be a blended program only. We have now opened this year for the first time a 5,000 student virtual academy because we definitely wanted to give our families choice who were not comfortable coming back to school, the opportunity to continue learning virtually. Lots of interesting conversation we could have around why people made that choice, but we've got about 5,000 kids in that program. And then lastly, what do we need to invest in to address interrupted learning and learning acceleration? And then the one we're here to talk about today, this big bucket of student wellness and mental health. But you can see that what we did was we brought together teams from across our district, teachers, media specialists, school counselors, assistant principals, and asked them to dream big. What does our district need in order to invest smartly in these 4 areas? And then a whole employee survey as well. So included every job family, bus drivers, paraprofessionals, assistants, to ensure that we were really seeking wide voice for this. Just last week, the way Georgia did our funding for ARPA, we got our first investment back at the start of the school year. We got a second investment a little bit later. We waited and held on our second investment to say, we got to get kids back and kind of see how things are going for us to decide how we want to spend the second, third, or exactly a third of the money. And so now we've just put it out to our entire community to say to our community, what do you want to see now that your kids have been back in our buildings? What are the needs that still exist within these 4 investment buckets? Now, I think it's really important to recognize that every one of these investment buckets has to have a line drawn back to student performance, student achievement, and learning. Of course, these ESSER funds require that a minimum of 20% of the funds that every district gets are spent directly tied to closing learning gaps. And so we went a little further with that to say that whether it was student mental health, whether it was interrupted learning, or even just modifications to the learning environment, there had to be a dotted or straight line exactly to the fact that it's got to impact student learning. We do these things because our core business is teaching and learning. All right, if we want to pop to the next slide, what you can see is that we made the decision to invest a big chunk of our money in the ARPA funds for mental health and wellness. And we did that by employing 53 mental health and wellness facilitators. Every single site, all of our program sites and our schools have been given a human capital to be able to be the conduit of serving students and employees and the needs that they have as a result of this interruption to our lives. Now, we also know that that interruption didn't just get created with COVID. There have been interruptions that have impacted students and employees for a long time, but we know that they've just simply been exacerbated by COVID. So we knew that we needed to not put the burden of all of the support for our students on the backs of the teachers, because the teachers themselves needed support. So having this mental health and wellness facilitator at every site to be the connector, the conduit, to ensure that the people who are responsible for students learning are able to focus on student learning, and that the students themselves have the support and services they need in order to be able to successfully learn. So what I really love about that is when I think about the poll that we did at the beginning that Adam shared with us, if you guys said those 3 tiers of support are really the 3 areas of focus that you are most concerned about or wanting to invest in. Well, by investing in human capital with this position, we've now ensured a systematic approach to all 3 of those tiers can happen on every single one of our 53 campuses. So we're excited about that. We think it's going to be an investment that pays off. We feel like having someone who has nothing but that as their dedicated work is going to be really smart. And then also being really smart from the very beginning to design how we're going to measure whether or not this systematic approach to mental health and wellness through this facilitator is going to lead to actual change in student perception as well as student performance. All right, I'm going to pass it back to you, Fred. Let's go to the next slide.
I'll definitely take it. And this is what is going well. When you make an investment in people, into programs, into school systems, you know, what is the impact on the outcome for students, staff, and the community? And we have a lot of things to kind of celebrate right now. We actually have a person in every building to make sure that every child is taken care of and that every adult is taken care of. Their job is targeted to make sure that they are a caring adult, a listening ear, and provide support and outside resources if needed. So that's been very effective. We've taken these 53 individuals, we've coached them up through a very series of trainings from youth mental health to secondary trauma, resiliency, mindset. So we've really kind of, really built their skill level. And I know that was one of the questions and concerns of the earlier poll question was, how do we build the capacity? And again, we have 53 people from different backgrounds and different levels of expertise. And we created a system to build everyone up to a foundation that they can in turn build out upon each school building. So we were really working on building out a system where it wasn't just house and one individual entire school building. It was the individual that went into that school building and started to train all the staff members on trauma-informed practices, train all the staff members on wellness and what it looks like to take care of yourself, how to help students take care of themselves, helping them understand what is conditions for learnings for schools to be successful. What do I need to do in my environment so that children feel safe and they feel like they have a voice? And so we were able to really create these systems from scratch to where we're at now. And the wonderful thing about this, when we start thinking about funds, is a lot of this training was free through colleges, through grants. So we're able to leverage a lot of the community resources to kind of give these new 53 mental health and wellness facilitators the skills they needed to go into a school building and be successful. And from there, we were able to create what we call a Henry Cares check-in process, where we are assessing student needs and staff needs in real time and actually responding to that. So we're able to hear the voices of the students, where they're struggling at, where their successes are, and we're able to kind of leverage that work back into the classroom in the school buildings. We're hearing from our staff members, what's the breakdown? And we're able to develop PD to help support them to make sure that they're doing their job more effectively and they have a way to kind of make sure they're taking care of themselves so they can take care of the students. And like I said, so that's been a very successful thing for us to have a process where we're assessing real-time data around mental health and wellness with all our community members. And now that in turn led schools to develop goals for this work. And so it's not just about reading and math, it's about the conditions that we're setting for our students around wellness. And so they now have goals that they're setting and action steps they're going to do throughout the year to kind of grow this climate and culture in each school building. And so as we kind of shift around a little bit, you start seeing that we had this big umbrella of Henry Cares. So we kind of took all of our services. So it wasn't by chance that a child got support, it was by design. And so at every school building you'll see in Henry County, and this is at no cost kind of support for schools, we developed what is called a care team. And the care team is made up of the counselors, the social workers, administrators, key individuals in each building, and now led by the mental health and wellness facilitators, which is the evolution from last year to this year. Having those extra funds allow us to have someone that's dedicated to this role to help drive this role. It's a group of individuals that meet on a regular basis to look at children's attendance, to support families getting kids to school, to help kids who are failing and making sure that if they're failing, what's the barrier and how can we remove that barrier? Kids that are in crisis or that are struggling with day-to-day activities, we're able to take this care team, wrap around them, make sure they know that there's somebody here to listen to them, to support them, and get them through this rough patch. And so as we kind of step back and reflect on where we use these funds and how it impacted the school building, we're seeing dramatic impact right now by investing in people and not necessarily just a program or a product, but actually putting people in there to really train up our school buildings to provide a foundation that we'll be able to build on for years past now. And so we kind of move on to the next slide. Now again, definitely there was challenges into this process because again, with any kind of implementation of a new idea of concept is how do we measure the success? And so one of the challenges that we had was really defining the district metrics for wellness. And so that was one thing that was not done in isolation. It was done through many voices of the community to first define what wellness was. When we say the word wellness, what does that mean to Henry County? What does that mean to a Henry County school, to a Henry County student, to a Henry County parent, and to a Henry County teacher? So we defined that wellness, and then we defined what we need to move in that area. And so we're able to kind of align kind of our check-ins with what our definition of wellness was. And we'll be able to track the growth of that across time to see, are we moving in the right direction? If not, what do we need to change to support our communities? Again, meeting needed results of staff development. Again, in this fast-paced world we're living in, required us to be able to react quickly, to provide targeted PD to our staff to make sure they are prepared to move forward and ensure the safety and the wellness of all our students. So each month, our facilitators go in and they do trainings on team building, self-care, wellness, trauma practices, and also what they need to be doing in the classroom to ensure students are feeling safe and feeling that they have a space to be heard. And again, continue to meet current community needs. Again, we don't want to just hear them one time and then move forward with what we want to do. You got to constantly loop back in the community to make sure we're moving in the right direction, to make sure that we're moving in hand in hand and step in step with our community and our board members and our superintendent. And I think Missy's going to kind of lean over to that long-term plan development that got us kind of the space we're going through for all this work that we're doing in Henry County.
Yeah, thanks, Fred. And I do see that Jessica answered Miriam's question. I mean, this idea about accountability and monitoring, measuring for impact is really one of the things we're grappling with right now. So you can kind of see that for every initiative we've invested money in, this is sort of the cycle that we're using. And to be quite honest, we're sort of having to develop and build the accountability and measuring for impact as we go. I'm doing some interesting work with a third-party consultant through Chiefs for Change about how do you do return on investment for academic performance for a position like a mental health and wellness facilitator. So stay tuned. We're working on actually defining that and sort of potentially creating a model for other districts to use to monitor for that return on investment, not only through the surveys that Jessica referenced and that Fred talked about through our check-ins, but also through looking at if we have a mental health and wellness facilitator for the purpose of ensuring students' conditions to learn are met, therefore they are learning at higher levels, we need to be able to quantify that through student academic performance, not just through the anecdotal not anecdotal, but how do we, perception surveys. So some of that is still in the works. If you want to hop to the next slide for me real quick, I won't spend a lot of time here. We did have to really be sure that we were setting the right stage for this. So we did a lot of work on the front end to ensure that we had a steady foundation, a strong foundation. We recognized that what COVID did was it put to the test the foundation that we had created. And so you can kind of see, we've been doing this foundation building from 17 to 20. We found that while we were glad we had the foundation we had, because prior to that, we didn't really have it, leaning in on that foundation caused stressors and it caused cracks. And so we've had to be really smart about identifying how these funds and how the work we're doing around setting the conditions for learning through mental health and wellness facilitation, how we're doing that to ensure we're filling in those gaps and cracks in the foundation. All right, let's kind of go to this last slide for me, and then oh no, 2 more slides on that. Sorry about that. But really, the idea is getting back to that question of sustainability. I mean, truly, we have launched a strategic plan in the middle of a worldwide pandemic. And in that strategic plan, we have elevated student wellness and safety and security of students as one of our future goals as part of the strategic plan. Now, the funding for these positions is 3 years. So we know for sure we've got 3 years with our mental health and wellness facilitators working with the folks in the building to help build their capacity. Now, the best case scenario is through really smart ROI strategy and research. We're able to show that we need to continue and move those mental health and wellness facilitators into our board's budget, that the board would then be able to change course and add that as a position at every building through the general fund. The worst case scenario is when 3 years are over, those funds don't exist for us to be able to create and maintain that position. We've got to be really sure for the next 3 years, we are building the capacity of everybody else on that CARES team and the teachers in that building to be facilitators themselves and understand the resources that are out there. So there's really a dual purpose of having those facilitators in the buildings. But we've also got to make sure we stay engaged with our community. We keep them at the front of it. We keep them understanding why these positions and this work needs to be sustained. And even potentially looking at our board using their voice through policy to be able to put that in a more solid way than just through the funding of an ARPA program. And then really it's stuff like this, right? It's about telling our story. It's about helping folks see that this is the right way to approach learning, that kids can't learn if those preconditions for learning aren't met. And so this kind of work isn't about a nice to have, it's about a must have if kids are going to be able to learn. And until we're really, really good at telling the story about how those things are connected, you run the risk of really having community members think that mental health and wellness of a student is over here and learning is over here. We know that they're interconnected and we have to do a good job telling that story. All right, Fred, wrap us out.
All right, just to finish up, kind of articulate Missy's great rounding up of the must-haves. Again, as you will see, we'll be able to track for future funding sustainability if we're seeing those changes in academics, if we're removing those barriers, if we're making sure those preconditions for learning is happening in the classroom, then we're going to see students' academics rise. We're going to see more students graduating from high school. We're going to see that pathway from pre-K or even before kindergarten all the way up to college and career ready. And we're going to be looking at our attendance. Again, as we address some of these spaces where kids are feeling stressed, depressed, anxiety, overwhelmed, and we're kind of creating a pathway for them to have supports at the school level, in the school building. We're going to see those attendance levels rise. Again, having staff retention is huge at this time, because again, there's a lot of needs for highly qualified staff, and sometimes there's not a lot of highly qualified staff sitting out there for you to pull them into the school building. So by making sure we're not just focusing on just students, but also employees too, we're going to see a change in terms of the quality of teachers we're retaining and the quality of teachers we're attracting and staff members are attracting to Henry County, because this is a space where we're not just focused about getting a number, we're about the whole child, the whole experience, making sure we're taking care of everybody that walks through the doors of a Henry County school. Again, being intentional about professional development, our CARES team, that we do a lot of data collection around CARES team, how we're making sure we're supporting kids that are in our schools and kids that have come through our schools to make sure if they left our school, we're following up with them to make sure, hey, we haven't heard from you, so we'll make sure you're doing okay. And also, again, to really utilize the data around our wellness program as we continue to build out the metrics and the structures around that. So again, we thank you for your time and your conversations, and we can't wait to hear some questions to hopefully help you be able to leverage some of this money to create more impact and change in your schools, communities, counties.
Thanks, everybody. Look forward to your questions.
Thank you both, Fred, Missy, fantastic stuff. Thank you so much. And thank you too to Jessica Stormer, also from Henry County, who has really been doing yeoman's work in the chat here. As many of you have probably noticed, great stuff going on in the chat here as well. All right, so now for the Q&A portion of our panel. Well, almost. We're going to do one more poll question before we get there. And as we're pulling up the poll question, let me also remind everyone that in a few minutes here, we will also be sharing with you the link to our evaluation forms. Again, one link for both forms, so just wait a second after the first one pops up and you'll get the second one. Those evaluation forms are hugely valuable to us. I see Sarah Trello put the link in the chat already, so if you're ready to start providing feedback, we would welcome that. All right, so the poll question here, Sarah, let's pull that up. When you are planning significant reforms to school mental health programs and structures in your community, which of the following is or are the most important entity or entities to have supporting the plan? Lots of different individuals and entities listed here. Appreciate your help in identifying who are the most important stakeholders to have on your side as you work on these issues. We definitely heard some from our panelists in their talks, the importance of working with multidisciplinary stakeholder groups, task forces, and so on, in order to make sure that everyone's perspectives are represented. But if you had to just prioritize a question to the panel on how do you approach so-and-so on these issues, it looks like the group is coalescing around the district or school board with a few answers scattered across the remainder of these answers. All right, so since we have limited time, let's go ahead and close the poll now. And let me turn to the panel and ask if you had any suggestions for attendees here about how to engage the district or school board and in garnering support for mental health programming or reforms, either related to ESSER or sustaining these programs after ESSER. Dr. Turner, maybe we'll start with you.
I'm happy to start, and I will reiterate that even 6-7 years ago, I was reporting to the school board about mental health issues, what we are hearing, just qualitative and quantitative information from our parents, from our principals, and gathering other data that has affected the whole learning process. So yes, going to the school board, making sure you are on the agenda, data-driven information with options for solutions, because that's what our school board always likes to hear as well.
Yeah, and I think it goes back to, you've got to know that your board has a core value that understands that students have to be well in order to learn. And so I think there's groundwork that needs to be done with your superintendent and board team, that governance team, to really value and speak out loud, potentially even through policy, the value that comes when a student's wellness is connected to their learning. So I think it's a matter of really working with the board to let their voice be the one that tells the community, and then having the community inform that as well. So when you go out and do town halls and you ask the community to dream big about what the purpose of school is and what you want to see more of in schools, which is one of the things that strategies we did to build our strategic plan, they tell you, we want this in the building. And so board members in Georgia anyway, for the most part, are elected. And so constituents and what constituents want in that voice of the community is very compelling then for the board's core values to reflect that community.
All right, that's great. Let me follow up on a few of the services and programs that you all have been mentioning. I know some school districts, perhaps some in attendance on our webinar today, may have limited administrative capacity or limited other financial support through general funds or otherwise. And I wondered if among the services and programs that you've been talking about, which would you say might be the quickest or easiest to implement, maybe preferably at low or no cost?
I'm happy to start. I have to say the success of our Parent Academy, that is the live stream Zoom, we have the capacity, the technology, and many districts do only because of the pandemic that we had to upgrade our technology for all children and families. The speakers that come, there has been no stipend. Our community has just rallied together and want to share information if they have expertise in areas. And we have a list of experts who want to speak. And of course, this generates more information for our community. So the Parent Academy has been a great success with truly no funding involved.
Henry County?
Yeah, and one practice and process that we put in place that cost absolutely nothing was the development of our care team. And so we created a care team model at every single school using the personnel that we have, using data that's already available to us. So looking at that early warning data, looking at the attendance, looking at behavioral data, looking at referral sources, and then aligning our teams together, creating a structure and a process for them to focus in. And somebody mentioned the wraparound model a little bit earlier. And so this is kind of a greatly modified wraparound model, but it is an intentional focus on individual student needs, looking at early warning data, and then aligning and connecting kids with the intervention supports and resources that we already have available to meet their needs. And so that cost us absolutely nothing. And it was incredibly powerful. All we had to do was develop the process. And so it was the process, creating the process, really like coaching up our personnel on how this can work. And then putting that into play at every single school for every single child. And it was incredible to watch that play out and be effective.
Jessica, I just want to ping onto that really quick and just say, I think what's key to these investments, whether they are the investments of humans' time or the investments of federal capital, it's got to be about people and systems and processes and not programs. I think the danger right now is with this kind of money, the easy thing to do is just buy programs. But if you haven't done the systems building that Jessica just described and that Fred talked about, you're just going to have a standalone program that in 3 years you can't fund and you don't really know where it fits in your organization. So I would just sort of caution folks that in this time where we do have money, we're careful about building the systems around tools and not just buying a lot of tools.
Such an important point, Missy.
I wanted to also mention about connections. That has been one of our priority, relationships and connections. And whether it is the hotline or the email account or the Parent Academy or whatever we're doing, putting more personnel in schools, it's forming those relationships so that we are seeing a greater increase in wellness and attendance and everything. So connections and relationships.
And Nancy,
That's
we
great.
couldn't agree more with that. So that's another thing too that we found really helpful was creating that time and space and the emphasis on relationships and how that is connected to a successful instructional environment. So it didn't cost anything. All we had to do was have buy-in from our instructional leaders, which obviously we have here, as you see, Mrs. Morse here with us today, but just creating that time and space and intentionality around relationships, and then just watching the effects of that play out.
Fantastic. We'll be mindful and respectful of everyone's time. So as we approach the end of the hour here, let me thank all of our panelists for their great work and for participating in this rich discussion today. Great stuff. Thank you all very much for sharing your experiences and insights. And now please do click the link in the chat or enter the address on your screen and answer the few questions about what you saw or didn't see today. Again, once you have submitted the feedback form that you get to immediately, a second Southeast MHTTC specific evaluation form will automatically pop up for you a few seconds later. The evaluations are required by our funder, SAMHSA, and so it is essential for us to continue doing this work that we have your input and use it to make our resources and events as valuable as possible. Thank you very much for taking the time. As a reminder, the recording and slides from today's webinar will be posted on our website in a few days, and you will be alerted to this by email at the address that you gave when registering for this event. So please look out for that. And again, please do visit the Southeast MHTTC website or follow our social media accounts for more information about our resources and upcoming events. Thank you all again. I appreciate your time and have a pleasant rest of your afternoon.